Let's come back to the mitochondria specifically. And we know that they're damaged by the ROS that they're producing. When it comes to regaining our metabolic health, what is the goal there? Once they're damaged, can we repair those? Are we just making new ones? Let's talk about that physiology and what our end goal is in that realm.
The body actually has this very sophisticated, elegant system to get rid of old or damaged cell parts and cells and replace them with new ones. And one term that a lot of people will use to describe that process is called autophagy. So it's the process by which your cells actually know how to identify which proteins or organelles or other parts of this cell are damaged or old, and we need to get rid of them. And when they get rid of them, what does that mean? It means they shuttle them to lysosomes where the lysosomes degrade these things, and then they reuse all the parts. Like the body is very frugal, because you never know when you might have a drought or famine. So it doesn't just like dispose of them and you pee them out or poop them out. It actually recycles them. It breaks it down into their component parts of carbohydrates or fatty molecules or amino acids, and then it reuses them. And so mitochondria undergo a similar process. So there's this subset of autophagy called mitophagy, in which old and defective mitochondria or mitochondria that are dysfunctional can be shuttled to lysosomes and degraded and recycled. There are some other mechanisms through which mitochondria can actually be removed from neurons in particular and other cells. So immune cells, for example, can actually connect themselves to neurons, for example. Like there are these things called microglia, and they can connect themselves to neurons, and they actually can take on some of these old damaged mitochondria and kind of serve as the waste disposal factory themselves, so that the neuron doesn't have to be bothered with like disposing of old and defective mitochondria. There are other cells that can actually do some of this work for the neuron. But at the end of the day, it's all about mitophagy, and then you need new mitochondria to take their place. And that is a process called mitochondrial biogenesis. So essentially, when your cells begin developing mitochondrial dysfunction, the path to healing is to stimulate processes that will identify those dysfunctional mitochondria, because you don't want to get rid of the healthy mitochondria. So you want to leave them alone. But again, the body amazingly knows how to do this on its own. It can identify the dysfunctional mitochondria, get rid of them, dispose of them, and now the cell no longer has as many dysfunctional mitochondria. And so the cell can make new mitochondria to take their place. And now the cell has done what we might call a refresh. Got a cleanse, if you will. Let's cleanse the old mitochondria, the dysfunctional mitochondria, and let's replace them with new ones.
And how do we support the body in doing that?
Autophagy is something that should be happening routinely, because cell parts are always becoming damaged or old. So we certainly need a low level of autophagy at all times. And in fact, in most psychiatric disorders and most neurodegenerative disorders, just sticking with the brain, we have known for years now that these disorders are associated with impairment in autophagy. So one of the primary ways to support this process is through fasting and fasting mimicking diets. And I actually think this is actually probably one of the reasons why fasting has been used for millennia in just about every culture on earth as a healing practice. Most religions use fasting. Um, so fasting has been around for a long time. And, for a long time, I think most modern people thought that it was all just crazy talk, or even dangerous kind of stuff. Like, oh, they're starving people. Some people equate those two terms, that they're not at all equatable. Going without food is normal. You should not be eating all night, every minute of every night. That going without food is called fasting. So all of us should fast. Obviously, there's a certain timeline, and if you fast for too long, then at some point it tips over into what we call starvation, and that is no longer healthy or good, and it is dangerous, and you can die from that actually. Uh, but I actually think that's the reason fasting's been around for so long, is because it supports this cleansing process. It supports this process of let's get rid of any old and defective cells or cell parts. So this can apply after you've had an infection. And infections have been around for millennia. So people would get sick, 1,000 years ago, and they might get sick from an infection. And so you may wonder, like, why would fasting be helpful for that? Well, if some cells became dysfunctional due to that infection, then fasting actually might stimulate a healing process to help that person heal and recover. Um, Now, at some point, you do have to reintroduce calories, because you don't just want to get rid of old cell parts. At some point you need to start replacing them with new cell parts. And that means the cells need fuel. They need more fuel, and they will get that fuel. Ironic or interestingly, I'm saying that a lot, but interestingly, uh, when when people are fasting, so their cells are recycling all sorts of old damaged parts. It's not just mitochondria. It's misfolded proteins. It's, plaques and tangles. You know those Alzheimer's things? Plaques and tangles start getting recycled. The cell starts clearing those out. Why? Because it needs fuel. It needs fuel, and it starts eating anything that it needs. Usually, when a cell is in that state, in a fasting state, it actually has processes in place to inhibit the production of new proteins and new membranes and other things, because the cell recognizes, whoa, it's famine time. We can't be producing new parts. Don't have enough fuel for that. Let's just go into survival mode. But the fascinating thing is new mitochondria are often produced in that state. So the cell actually prioritizes the production of more mitochondria. And we really don't have a clear answer of why would the cell do that. My speculation is because mitochondria are going to save the day. Mitochondria are going to send the right signals, because they're doing so much more. They're helping that cell adapt. They're changing gene expression. They're regulating calcium levels. They're regulating hormones. And so when the cell is really stressed, what does the cell do? It says, let's make more mitochondria to help save the day. We need more troops, so to speak.
Okay. In a practical sense, because there are so many different types of fasts, different lengths, are we talking about an overnight fast here? We could go all the way to a 40-day water fast. There's dry fasting. How does somebody know what type and how far to push it to get these benefits?
That's a really important question. And I'm going to say there's not a one size fits all answer for that. Let me just be clear. So, first and foremost, I would say there are some people who absolutely unequivocally should not fast for their health. Who would that be? People who are already starving to death and emaciated. So that would include somebody with anorexia nervosa. That might include somebody with severe like cancer who's just gone through radiation and chemo and is now emaciated, has lost a ton of weight. Those people should not be fasting. Now, we can talk about fasting mimicking diets so that they can get some of these benefits, but they need calories. They should not be going without calories. The other group that I'll put in there who should not be fasting as a rule of thumb, at least not for prolonged periods of time, would be growing children who are at least normal weight. So if a child is really obese, then maybe some fasting could be helpful if the child is interested in doing that. Um, but normal weight growing children should not be going without calories for prolonged periods of time. And I would say pregnant women should not be going without calories for prolonged periods of time. That they are trying to produce and grow a brand new human being. And that takes a lot of calories and resources and energy and every nutrients and all sorts of stuff. And so if women start fasting during pregnancy, and we actually have good data from this, from like the famine studies of populations, that when women go without calories for prolonged periods of time while they're pregnant, that can have very severe adverse effects on their children. So those are the categories that I would say should not be fasting at all. And then to answer your question, so who should do fasting? How long? It really depends. Are we talking about somebody who weighs 600 pounds, who is severely ill, but also has a tremendous calorie surplus on their body ready to be tapped into? Well, that person, I might actually be okay with that person if they want to do a prolonged fast for 7 days, 14 days, 21 days. I would not recommend a dry fast myself. That can be dangerous actually. So I would recommend a water fast. But if that person wants to do a water fast for a prolonged period of time, especially if they can get medical supervision to just make sure they're going to be okay through all of that, yes. And I sometimes do that with some of my patients who are really overweight and potentially diabetic and really could use some rapid improvement. And you can actually see very rapid improvement with that model. But other people, it's going to be more complicated again. So it's really about walking the line between therapeutic fasting, which has benefits and it has healing potential. And if you push the boundary too much, you end up in what's called starvation. And starvation is life threatening and very dangerous. And so you have to know where that line is, and it's different for different people depending on those factors that I just outlined.
What about yourself? Somebody who's normal weight, understands the importance of mitochondrial health. Do you have a certain practice that you're doing weekly, daily, monthly to help keep those mitochondria healthy?
I definitely implement some type of intermittent fasting. I'm not on like a schedule, but I'll go, just a few days ago. It was more because I was so busy with work, but I just didn't eat. And it really started. I had not planned to fast that day. But I was just busy and I'm like, well, I don't have time. I'm not too hungry. And then And then as the day went on and lunchtime came and I realized, wait, I don't know if I have time for lunch. I actually thought, oh, this will be a good day to fast. I'll just throw in a fast and call it. I'll make lemonade out of lemons of a busy work schedule that doesn't allow me time to eat. Um, do I do it regularly? I do kind of. I definitely skip meals, skipping breakfast, skipping lunch. Uh, are easier for me. It's harder for me to skip dinner. When I skip dinner, I sometimes have trouble sleeping. Honestly, I get a little revved up from the fast. So I personally tend not to skip dinner, but I think for people who can sleep well and skip dinner, skipping dinner is probably more therapeutic because then you go through the whole night and you get a longer window of a fast in. So I think that's more therapeutic. I think I'm just one of those people who's kind of sensitive to it. So I usually don't because I like my sleep.
So we know there's mitophagy, where different parts of old mitochondria are being recycled and reused. We know we can make new mitochondria, including using those parts. Is there any such a thing as building bigger mitochondria, increasing the density of mitochondria within a cell, doing some of this that we're talking about to create a more robust body metabolically?
Yeah, well, 100%. The clearest example. So mitochondrial density, for example, how many mitochondria are in a cell? The rule of thumb is that the more mitochondria, the more healthy mitochondria, I should say, that are in a cell, the more resilient that cell will be, the more capacity and endurance that cell will have. And do we have any evidence for that? We have an abundance of evidence for that, and it's called athletes. So athletes, really, athletes kind of sometimes, taking apart all of the talent and balance and different types of body strength that you might need and everything else. So all of that matters, and size matters because, super tall people usually are not gymnasts because they just can't contort their body in those ways or whatever. So yes, but there are two kind of buckets for athletes, and one is larger muscles that allow for more power, and the other is muscles that allow for endurance. And the muscles that allow for endurance are usually not that much bigger. Sometimes they're smaller even. And the clear example of this are marathon runners. So marathon runners, when you look at a marathon runner, if you meet them, they actually don't usually look like a big tough athlete. They can just look like an everyday Joe. Even if they can run 100 miles without stopping. They don't look that much different. And why is that? It's because their muscles aren't much bigger. So what makes their muscle different than my muscles? Because I can't run that far. I can't run that far without stopping. So what makes their muscles different than my muscle? One and only one thing: the number of mitochondria in their muscle cells. So if you took a biopsy of their muscle cells would have abundant mitochondria, just all packed together. And if you took a biopsy of my muscle cell, it would have fewer mitochondria. They would be more spaced out. So I think that, does the same thing occur in the brain? I'm not aware of whether we have clear, compelling evidence for that, but I suspect it does occur. With liver cells, for example, we know that when liver cells have more mitochondria, they are healthier, function better. That liver is healthier, less likely to have a fatty liver. The other clear example uncontrovertible are fat cells. So we have 3 different types of fat cells, probably more, but I'll put them into 3 buckets: white fat, brown fat, and beige fat. And as most people know, brown fat is kind of good for you, white fat is bad for you, and beige fat is kind of in between. And what makes fat cells white, brown, or beige? It's the number of mitochondria in the fat cell. Brown fat has a lot more mitochondria. White fat has fewer mitochondria, and oftentimes those mitochondria are somewhat dysfunctional. In obese people in particular, they have even fewer mitochondria, and the mitochondria are in fact dysfunctional. And what we think is happening is that their mitochondria become so dysfunctional or impaired that they can't release the fat from the cell. That is why they are stuck with fat on their body, is that their fat cells are impaired. They can't function properly. Because one of the functions of fat cells is to store fat. But an equally critically important function of a fat cell is to release that fat. And mitochondria are instrumental in that process. Mitochondria are doing a lot of the work to release that fat from that cell. So if mitochondria are dysfunctional, the fat becomes trapped, and then people just develop obesity, and it just grows and grows and shows no stopping it.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
There is zero doubt in my mind, as a clinician who works with people with treatment-resistant mental illnesses, that ketogenic diets can be life-changing for some people. The very first signs of Parkinson's disease